Opioids are often used to treat postoperative pain, and Dr. Andrew Noble, an orthopedic surgeon at the Palm Beach Orthopedic Institute in Jupiter and Palm Beach Gardens, is trying to get his patients through orthopedic surgery while minimizing the use of opioids. And he's using this FDA-approved, innovative solution. It's a non-opioid option that lasts up to 3 days after surgery. He's with us today to share more. Welcome, Dr. Noble.
Great, thanks for having me.
Absolutely, it's really important to educate your patients on their treatment. So as a surgeon, what has been the biggest challenge in postoperative pain management and trying to minimize opioid use?
Managing postoperative pain for the first 3 days after surgery is critical because this is when pain and inflammation is most severe. It turns out a lot of times we've been using local anesthetics to help reduce pain and numb the area, but unfortunately a lot of these medications don't provide consistent pain relief beyond 12 to 24 hours after surgery. And this is what contributes to our extensive use of opioids to help treat the patient's pain and keep them comfortable afterwards.
Now, what is your solution that you mentioned as a non-opioid option to treat pain?
So I'm here in partnership with Heron Therapeutics to discuss today this medication called Zynrelef. It is a combination of bupivacaine and meloxicam. It's the first and only dual-acting extended-release medication that is used to treat pain for up to 3 days in adults after they undergo foot and ankle procedures, abdominal procedures that are either small or medium in size, as well as total joint replacements involving the lower extremities, such as total hip replacement, total knee replacement, or total ankle replacement.
Now, to be clear, this is not a pill.
That's correct. So this is not a medication that patients take by mouth. It's actually something that's applied at the time of surgery by the surgeon. Zynrelef is the first and only medication that has been designed to treat both the pain and inflammation at the surgical site. It contains a low dose of the medication called meloxicam, which neutralizes the environment and allows the local anesthetic to be more effective. This medication also has a special polymer that releases the active ingredients over time, allowing the medication to last for up to 3 days.
Got it. So what does this mean for the patients?
In the past, before I was using this product, patients would stay in the hospital for about 3 nights and require a lot more opioids than they do today. Nowadays, patients are going home the same day or potentially staying 1 night overnight, and a lot of times they're only requiring a few opioid pills and potentially none at all after having their knee or hip replacement surgery. Recently, one of my patients commented on how much better she felt with her most recent knee replacement 1 day after surgery compared to the other side that was done previously. Wow. She had so little pain that she wanted to confirm that I actually did the surgery the day before.
She didn't even know. That's great to hear. And how can people learn more about this Zynrelef?
So I'd encourage patients to talk to their surgeon about using Zynrelef potentially during their surgery. And they can go to zynrelef.com to learn more about the product, full prescribing information, as well as the box warning.